Hello everyone, my name is Dr. Joel Rosen. I am an adrenal fatigue recovery ninja, and I wanted to talk to you again about spinal problems, musculoskeletal pain, inflammation, migraine headaches, joint and shoulder injuries, being in front of a computer all day long with crappy posture, and the role that that plays with your adrenal glands. And today I had a consult with a patient who re-reviewed their MRI today, and she had a herniated disc revealed at C6, C7 as a result of a motor vehicle accident. And she told me that, or asked me, what is the implications on her long-term health? And I thought the answer that I gave her was going to be really enlightening to you guys because I see this all the time. What I told her, she is a 35-year-old female, and I told her if we just went out into the public and grabbed a random amount of people that were between 30 and 40 years old, a certain percentage of them are going to have some kind of findings that would have been revealed on an MRI, whether or not they've even had an MRI, or sorry, whether or not they've even had an accident. Just from wear and tear, from traumas, maybe they have had an accident, pregnancies, just the fact that the gravitational pull of the earth pulls us downwards and compresses our discs. And so I told her one of the worst things that I see happen a lot of the times with my musculoskeletal pain patients is the fact that sometimes the MRI is the worst thing that we could possibly get to know what is already going in our body that we wouldn't have known prior to not having the MRI. So what does that mean? That means I could have a couple compressions in my discs, at least some degenerative disc disease or dehydration of the bone, of the joints, rubbing and grinding of the joints in the spine or in the limbs or in the shoulder and the knees, and I know it's painful, but when I get an MRI finding that confirms the pathology, then all of a sudden my mind makes me think, oh my goodness, this is worse than I had even imagined. And had my mind not know that, I probably wouldn't have suffered as much as I possibly could have. So the take-home lesson is just because you know something doesn't make it worse or better. And in fact, most of the times it's better to know that you don't have it than to know that you do have it. Secondarily, she asked me what are her recommendations for exercise. And I give this answer to every one of my patients because I'm a big believer of exercise and rehabilitation and functional training and core strength and flexibility and just good muscle tone. And I told her, think of your injury like an athlete thinks of their injury. The athlete has to go through a certain protocol. They got to go to the team doctors. They got to go through the proper opinions, get a first and second and third opinion. This is a big asset or a big investment for sports teams, as well as the athlete himself or herself. They got to get back onto the field as soon as possible. So what do? They go through a graduated care plan. They determine the extent of the injury. They reduce the acute phases of the care and inflammation and pain. But you better believe that they're going to exercise and start off slowly to where they're doing non-weight bearing exercises to eventually doing weight bearing exercises to eventually doing more functional movements and cross movements and combination movements and power movements to the point where they're going to be stronger, faster, bigger, and more equipped than they would have been had they not had the injury, because at the end of the day, it's their life, it's their career, it's their salary, it's their children and their children that's on the line. And so they don't have time to not get back into the gym or into the rehabilitation world. They need to. And so look at it in terms of I need to exercise because I'm injured, not I can't exercise because I'm injured. And so that mindset really changes around the dynamics of how you're going to recover from your injuries or your debilitating pain. And think of it as I need to exercise because of my pain, not I can't exercise because of my pain. Now that's a fine double-edged sword as to what you can and can't do, but the mindset should be such that when you have an injury, when you have wear and tear, when you have stenosis, when you have a surgery or scar tissue, you need to get back into your strength and you need to start off slowly and graduate to the point where you're bigger, stronger, faster than you were before. So anyways, I hope you enjoyed this lesson. I think it's really informative to you, and I look forward to helping you in your adrenal fatigue recovery nightmare. Thank you so much.